Hello everyone, we are group 6 and the topic we will talk about is allergies and there are 5 essential words. Hypersensitivity, antigen, tuberculosis, inflammatory, latex. And what is allergic? And we often have allergic reaction which are also called hypersensitivity due to pollutants in the external environment. Do you know why it happened? The causes of allergies are mainly divided into external causes as well as internal causes. External causes refer to immune disorders and external causes due to the external pollutant stimulation. There is a saying that in progressive countries or public health conscious cities, people from an early age lack proper infection, inadequate immunization training, but are more prone to allergies. So many people ask, is the immune system too strong or too weak for the allergy? In fact, the answer is neither. But oversensitive, the characteristic of the performance is that it is easy to catch a cold and infection. And there are 4 types of hypersensitivity. And the type 1 is immediately hypersensitive, which is the most common allergic reaction. So we put the most proportion to say it. As it cold, it appears after a few seconds to minutes. The symptoms always come with difficulty breathing, swelling, low blood pressure, blushy skin, and shock. Most people in Taiwan are afflicted by this type of hypersensitive reaction. And how did this happen? And the reaction requires pre-sensitization during the sensitization, the body immune systems initially come into contact with the allergens such as pollen, animal dander, insect bites, dust mites, or certain foods in tissue. The allergen fly to the receptors present on B cell, and the B cell will put some information on the beside. And T helper cells bind to the complex. The T helper cells is activated the release some medium to activate the B cells generate plasma cells. The plasma cells produce and release IgE antibodies. The antibodies have 2 variable regions, which enable binding the specific antigen, and its constant regions can dock on the surface receptor on mast cells, which are now able to respond when re-exposed to the same allergen. The mast cell is now sensitized to the allergen. When the allergen again binds to the IgE receptors on mast cells, the mast cells will immediately induce inflammatory mediators. The inflammatory mediators are the reason why people got difficulty breathing, swelling, low blood, skin, and shock. And then we will talk about the type 2 hypersensitive reaction. And this reaction always appears after minutes to hours, and it usually causes anemia, thrombocytopenia, and neutropenia. And the most common allergens are the antigens on the surface of red blood cells, including A, B, O antigens. As everyone knows, everyone has different blood types. As a result, when a person got the wrong type of blood, type 2 hypersensitive reaction will happen. Then we give the mic to another lecturer.
The third type of allergies is immunocompromised hypersensitivity. It is caused by immunocompromise, which is also known as antigen-antibody complex. Immunocomplexes are composed of antigen and antibody, and after several hours they are dispersed in the walls of blood vessels. They lead to allergic reactions that cause inflammation and tissue damage. The common symptoms include lupus, serious sickness, and auto reaction. The last type is delayed type hypersensitivity. It is named because after containing certain allergens, symptoms need more than 1 day to occur. It is caused due to T-cell misjudgment of the target and damage to the tissues. because it usually takes about 48 to 72 hours for the T cells to convert to the site of action. Most of the tissue's inflammatory began to take effect during this period. The typical symptoms are tuberculosis and hypersensitivity pneumonia. Common allergens in Taiwan. Common allergens in Taiwan can be roughly divided into four. The first type of allergens is inhalation allergens. The type of allergens is present in the air and enter the body through the respiratory tract. It contains dust mites, cockroach, mold, and animal hair. Next type is edible allergens. It usually enters the body as the food passing through the digestive tract, potentially cause skin or gastrointestinal systems, or even systemic allergic reactions. For example, milk, nuts, seafood, and others. The third type is contact allergens. It triggers an allergic reaction by skin contact. It contains hair, cosmetics, dyes, menthol, and latex. The final is special injection. It is injected into the body by injection of drug or mosquito bite. This type of allergens mainly contains insert survivor venous drugs such as some antibiotics and aspirin. Treatment. The best way to avoid allergens is to stay away from whatever triggers the reactions. If that's not possible, there are treatment options available. Medicine. Allergy treatment often includes medications like antihistaminic to control symptoms. The medication can be over the counter or prescription. When your doctor recommends depends on severity of your allergies. Some medicine may increase the risk of serious behavioral and mood changes, such as suicidal thoughts and actions. Immunotherapies. Many people opt for immunotherapies these years. This involves several injections over the course of a few years to help your body get used to your allergies. Successful immunotherapies can prevent allergic symptoms from returning. We understand and face allergens as well as control environmental elements including temperature, humidity, and pollution. The allergen will be successful in control and prevention. Thanks for your attention. Question 1. What are the most common allergens? Question 2. Which cell is dysfunctional and causes allergic reactions? Question 3. Is the immune system too strong or too weak for the allergy